Senator Cassidy is here. Senator Cassidy, a very valued member with his expertise on healthcare as a physician. Senator Cassidy.
Yeah, thank you there. Thank you very much for that. By the way, I thought I had 15 or 20 more minutes to listen, and everybody else is out. So anyway, thanks for going there. Um, Dr. Hoover, I used to work with school-based clinics to do hepatitis B immunization, very aware of how well they can function bringing care. Now, first, I think we have to acknowledge if the child is not in school, it's difficult for the child to be evaluated. But that said, but now the kids are back in school, so there's some progress there. But let me ask, and you may have covered this, I was in another committee hearing. My understanding is that the schools and the school systems would benefit. Would CMS give some updated guidance as to the possibility of providing these services in that venue? Any comments on that, Dr. Hoover?
That's exactly right, Senator Cassidy. I appreciate the question. And you are correct that it is easier to get school-based care to young people when they are actually in schools. And one of the things that we are hoping Congress can support is really urging CMS to modernize the existing school guidance for Medicaid in schools. This guidance has not been updated since 2003. And it's critical for states and education and state Medicaid agencies to work together to actually be able to support and resource mental health
Now, let
providers.
me ask you, I have
Yeah,
limited time. Put a
sure.
point on it. What is the problem with the current guidance or lack thereof that limits the ability to expand mental health services through the school-based clinic?
Yep. So just quickly, a lot of states don't want to move forward with implementing the current Medicaid supported mental health services in schools. They're worried, they're hesitant that expanding their programs may put them at audit risk. The guidance really is not updated to reflect improvements in telehealth. It's not updated to reflect the free care policy reversal in 2014. So there are a number of updates to Medicaid that would need to be reflected in this guidance for states to feel comfortable moving forward.
And specifically, you mentioned telemental health. I'm really struck. If you look at adolescent psychiatrists in my state, they're in the cities. They are not in the rural area. So, one, the infrastructure bill will expand internet services throughout the state. That'll be huge. But secondly, you got to get the adolescent psych who's in Shreveport to be able to communicate to the child who might be in Wynn Parish. You don't know the geography of my state, but suffice that's urban to rural. What impediments right now does the rule give as regards the utilization of that telemental health?
Yeah. So as you know, during COVID, we saw a huge expansion of telehealth, and we know that providers and families need guidance and technical support to actually use the telehealth equipment. But more important than that, we need to see the continued expansion of reimbursement and policies that support teleproviders to be able to not only provide services within their communities, but even across state lines as necessary to address some of the workforce shortages.
Now, if you gave advice to this committee, because we have jurisdiction over Medicare, Medicaid, CMS, one, you just to urge CMS to update these. And again, is there any single point? You're talking to Wyden and Crapo right now. They're the straws that stir the drink of Medicaid, Medicare, and CMS. So if you had to kind of just sit down and pound your table, pound your hand on the table, what would you say, our chair and ranking member? We got to get this done before we move on.
Absolutely. I would say that Congress should encourage all states to cover all medically necessary mental health services, including prevention services for all Medicaid enrolled students, and simultaneously ensure that school Medicaid programs have updated guidance, best practice, and technical assistance that they need.
Ms. Terrell, can you just put the dot on the I as regards the importance of school-based clinics as regards provision of mental health?
Of course, yeah. Like I said, this is a great question because I think it's so relevant. And when the teens are able to get care where they are, that just encourages help-seeking behaviors. It promotes developing systems of self-care, and it really promotes general health and well-being outcomes. I think the fact that teens are sometimes able to just walk over to a medical clinic and get the help that they need is so essential, especially if they're not able to at home. They don't have reliable internet access. So when we concentrate our efforts on schools, it's really important to make sure that we build these natural partnerships and kind of leverage the power within those.
I will just add to that from my experience working with school-based clinics, sometimes there's issues which should not be, for example, abuse by a parent, which can be discussed in the safe setting of a school-based clinic with a licensed healthcare provider. And it also, frankly, helps the business model of the school-based clinic. In some states, they have a very difficult time keeping their doors open. So if they can provide a needed service, it actually benefits. With that, I yield back, Mr. Chair.
I thank you, Senator Cassidy, and for our guests, Senator Cassidy and Senator Carper are going to be leading the task force on young people, so they're going to be invaluable on the issues we're dealing with.